Have you ever experienced a pounding headache that seems to throb in time with your heartbeat? One that makes it feel as though there's a drum solo happening inside your skull? If so, chances are you've had a taste of what a migraine feels like. Migraines are no ordinary headaches. They are recurrent, often severe, and typically affect one side of the head. They can last anywhere from 4 to 72 hours if left untreated. But what is it that triggers these debilitating headaches? Well, the triggers can be as varied as the people who suffer from them. Hormonal changes, stress, and sleep disturbances can all be culprits. Even something as simple as skipping a meal or being exposed to bright lights or loud sounds can set off a migraine. For some, changes in weather, certain foods, and medications can also be triggers. Now, you may have heard of a migraine aura. This is not some mystical energy field, but rather a set of neurological symptoms that precede the headache. These can include visual disturbances, numbness, or dizziness. But what's happening in the brain to cause all of this? Well, the exact causes of migraines are not entirely understood, but they involve a complex interaction of brain chemicals, blood vessels, and nerves. During a migraine, blood vessels enlarge and press on nerve fibers, causing them to release inflammatory substances around the blood vessels and meninges. This nerve stimulation and inflammation are what cause the pain. There's also a genetic component to migraines. They often run in families, and mutations in certain genes may play a part. Imbalances in brain chemicals like serotonin, dopamine, and CGRP can trigger migraines. For women, fluctuating estrogen levels during the menstrual cycle can trigger what are known as menstrual migraines. Hormonal birth control may also influence the frequency of migraines. Less common underlying causes can include neurological disorders, head trauma, strokes, or environmental toxins. So what can we do about migraines? Identifying and avoiding individual triggers can help prevent them. Medications can also be used to treat or prevent migraines. To sum up, migraines are severe, recurrent headaches that can be triggered by a variety of factors, from stress and sleep disturbances to hormonal changes in certain foods. They involve a complex interaction of brain chemicals, blood vessels, and nerves, and can often be prevented by identifying and avoiding triggers. Remember, if you're suffering from migraines, you're not alone. Reach out to a medical professional for advice and treatment options. There's no need for you to march to the beat of your own headache. For treatment, consider taking an appointment at Homoeopathicwala Clinic. You can reach out to them at 7836908343. They also offer online consultations for those unable to make it in person. Don't suffer in silence. Reach out for help. The first step towards managing your migraines is seeking help.